Hi, it's Dr. Sean Carlson here at Simple Orthodontics in Larkspur, California. And one of those common questions I get when I'm out and about and I'm talking to moms is, what is phase one orthodontics? Why are kids getting braces so early? And this is a question that deserves a detailed answer, and we're gonna get to that in today's video. So phase one orthodontics, or preventive orthodontics, is usually something that happens for kids around second, third, fourth grade. And it really involves doing the orthodontic movement in something called the mixed dentition, which is half baby teeth, half adult teeth. Now, why would we do early treatment when all of the adult teeth haven't erupted? And the reason is the foundation of the adult teeth has formed in that mixed dentition. And if it's off, if the foundation is not correct, we want to address it before the adult teeth erupt. And this is a real important point, because the adult teeth, you can think of them, it's like the house on the foundation. If the foundation is not correct, for example, if we don't have symmetric jaws, top and bottom, if we don't have the correct smile width, if that foundation is not correct and the adult teeth erupt into a malformed foundation, you've got a house on a terrible foundation. Now, you can straighten out the teeth, you can straighten out the house, but if the foundation isn't correct, then you're building the house on a problem. Now, young children's jaws have so much flexibility. They are so malleable that intervening at an early age can really have big, long-term, lasting effects on the smile. Now, I've been treating kids for 25 years, and one of the things that I notice from thousands of orthodontic finishes is patients that have good foundations tend to have very stable smiles, and they look beautiful and handsome. And this is something that when the foundation is off, no matter what I do as an orthodontist to straighten all of the teeth, if I'm working on a foundation that is malformed, I'm not gonna get the result I want, and it's certainly not gonna be very stable. So this is one of those things, like if you think about healthcare, there's some very important preventative things that we do as human beings to make sure that our lives are healthy and happy. We eat right, we exercise, we get the right medical intervention to prevent more serious disease down the road. And that's exactly what phase one orthodontics does. Now, it's important to remember not every child needs interceptive treatment or phase one orthodontics. But if your child does require treatment, it's very important that you do it. And the biggest reason is you're going to avoid very expensive and very invasive procedures later. And these mean surgeries that are very challenging for both the patient and the doctor performing them. And the results can tend to be not as good if teeth have trouble erupting, if they become impacted, if jaw surgeries are required. All of those things are often preventable from phase one orthodontic treatment. Now, the best time for your child to be seen by your dentist or orthodontist for an early orthodontic screening is around age 7. And this is exactly what the American Association of Orthodontists recommends. Sometimes the problems aren't obvious from the front if you just look at your child's smile. Sometimes there are things going on underneath the gums that require a professional to evaluate. Now, the good news is the way this type of treatment is done nowadays is super simple. And oftentimes it doesn't mean braces at all. Most of the time, we're able to treat these early intervention phase one cases with simple aligners. And it's very easy for your child to go through this treatment. No pokey wires, no brackets, no separators, no molds and impressions. All those things are now something we don't do typically, certainly in our office here at Simple. Everything is done with very high technology, and we're often just using aligners for phase one treatment. So phase one treatment can typically be completed in under a year. Here in our office, usually patients are in treatment for about 8 to 10 months, and that usually rectifies all of the issues that we have with the foundation. When we've done that foundational treatment with the phase one orthodontics, the adult teeth tend to erupt exactly where they're supposed to. That means the smile aesthetics naturally are in a good place. The alignment of the adult teeth naturally is in a good place. And the stability of the position of the smile and the adult teeth is naturally in a good place. And that's exactly what we want because nature really likes to stay stable. So our goal really is to lean into Mother Nature with preventive phase 1 care, make sure that the adult teeth can erupt where they're supposed to, and make your child's life and smile that much better with a little bit of early intervention. So if your child is in 2nd or 3rd grade, it's time to get them looked at by an orthodontist. We recommend getting that screening done by an orthodontist that's going to take a 3-dimensional image of your child's teeth so they can really diagnose where all of those adult teeth are erupting and make sure you don't have any problems waiting for you down the road. We're always available here at Simple to answer your questions about early treatment, so feel free to reach out to us. Follow us on Facebook, Instagram, and YouTube for more videos like this. Until then, stay tuned to this channel for lots more information. Be well and smile more.